Hello there. So, you think your cat might be pregnant. I know that can bring on a whole mix of feelings, a little bit of excitement, and maybe a whole lot of questions. But don't you worry, we're going to walk through everything together so you can feel confident and ready for the journey ahead. Have you noticed she's acting, well, a little different lately? Maybe she's snoozing more than usual, or suddenly she can't get enough cuddles. These little shifts in behavior are often the very first clues. So let's dive in and talk about what you should be looking for. Okay, so some of the first signs are physical. Around 3 weeks in, you might notice her nipples look a little swollen and a much brighter pink. It's a classic sign that people in the know call pinking up. And her personality might change a bit too. She could become a total lap cat, or maybe a little more demanding. Her appetite will definitely kick up. And yeah, just like us, some cats get a bit of morning sickness. These are all totally normal things to see. So you've spotted a few of these signs, and you've got a hunch. While watching her at home is a great first step, the only way to be 100% sure is to get a professional to confirm it. And that, of course, means a trip to the vet. A vet visit will clear things up right away. An experienced vet can sometimes gently feel the little developing embryos as early as day 17. An ultrasound is even cooler. You can actually see their tiny heartbeats starting around day 21. And then, later on, after day 45, an X-ray is the best and safest way to get a really accurate head count of how many kittens you should be preparing for. All right, once it's confirmed, the countdown is officially on. A cat's pregnancy is, believe it or not, a really fast journey. Understanding the timeline is going to help you support her every step of the way. So what exactly happens over those 9 weeks? The whole thing, from start to finish, is only about 63 to 65 days. That's it. Just about 9 weeks. And because that timeline is so short, things change really, really fast, which is exactly why being prepared is so important. The first couple of weeks are pretty quiet, but by week 3 or 4, you'll start to see those early signs we talked about. By week 6, though, there's no hiding it. Her belly will be very round, and if you watch her quietly, you might even see little kicks and wiggles from the kittens inside. Then in that final stretch, her instincts just completely take over. She'll start nesting, looking for the perfect spot, and in that last week, she might seem a little antsy as her body gets ready for labor. Let's circle back to pinking up for a second. It's one of the most reliable early signs you can see for yourself. It's all thanks to a surge of hormones and extra blood flow as her body gets ready to nurse. It's really a fantastic little visual clue that big things are happening inside. I know, seeing your cat vomit can be a bit scary. But a little bit of morning sickness right around week 4 is actually pretty common. The thing to watch for is how often it's happening. If it seems like she's vomiting all the time or she's lost her appetite, that's your signal to pick up the phone and call your vet. Okay, so the pregnancy is confirmed. Your job now shifts to being the best caregiver you can be for your expectant queen. Her needs for food, safety, and just general comfort are about to change in a big way. Her need for energy is about to go through the roof. This is when you'll want to switch her over to a high-quality kitten food. It's packed with the extra calories and nutrients she needs to grow healthy babies. And as the kittens get bigger, they'll start crowding her stomach, so giving her smaller, more frequent meals is way more comfortable. All told, you can expect her to eat about 1.5 times her normal amount of food. Safety is absolutely key here. Ideally, her vaccinations are all up to date before she gets pregnant. But during the pregnancy, you should never, ever give her any medications, and that includes flea and worm treatments, without getting the okay from your vet first. Be really gentle when you handle her, and try to avoid picking her up by her belly. And as the due date gets close, keeping her indoors for those last 2 weeks is a must. It just ensures she has a safe, clean place to have her kittens. We are on the home stretch. These last few weeks are all about setting up a safe space for the birth, and learning how to read the signs that labor is about to start. This is when her natural instincts really shine, and you can do a lot to help her feel safe and secure. Your cat is going to be on the lookout for a nesting spot, and you can help her by making the perfect one. Honestly, a simple cardboard box in a quiet, warm closet or corner is perfect. Just line it with some soft, clean towels or blankets that you don't mind getting messy. The whole idea is to make it feel safe and private. If you show it to her a couple of weeks ahead of time, she'll have plenty of time to check it out and claim it as her own. In the final 24 hours, you'll see some really clear changes. She'll probably stop eating and get very restless, pacing around, maybe panting or meowing more than usual. A really reliable sign, if you're able to check, is a drop in her rectal temperature to below 100 degrees Fahrenheit.
She might also start coming to you for a little extra comfort. She knows something's happening.
Labor itself happens in 3 stages. Stage 1 is that restless period we just talked about. Her contractions are starting, but you can't see them. Stage 2 is the active part, with visible pushing, and that ends with the kitten being born. And stage 3 is when she passes the placenta for that kitten. She'll basically cycle through stages 2 and 3 until all the kittens have arrived. Now, most cats are absolute pros at this and deliver with no problems at all. But it is so important for you to know when something isn't right. Being able to spot a warning sign and knowing when to get help can make all the difference. Just try to stay calm, watch her closely, and keep your vet's number handy. This is a big one. Labor can take a while, but if she's pushing hard with strong contractions for more than an hour and no kitten has come out, that is a major red flag. She needs help, and you should call your vet immediately. And here are some other signs that mean you need to get help right away. Any bleeding at all during the pregnancy is not normal. During the birth, if you can see a kitten but it isn't delivered after about 10 minutes of pushing, that's an emergency. And after the birth, keep an eye on the new mom. If she seems sick, has a fever, or just isn't interested in her new babies, that's a reason to call the vet. So, once the kittens are weaned and off to their new homes, it's a good time to think about the future. Spaying is, without a doubt, the best way to prevent more litters, but it also has huge health benefits for her. It dramatically lowers her risk of certain cancers and completely eliminates the risk of a really dangerous uterine infection called pyometra. So if you take one thing away from all of this, let it be this. Being prepared is everything. Seriously. By understanding the process, giving her the right care, and knowing when to ask for help, you can make this whole experience so much safer and calmer for your cat, and honestly for you too. Because the birth is really just the start of a whole new adventure, isn't it? Raising those tiny little newborns is the next chapter, and it's a pretty exciting one.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice.
If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.